Okay. I know the number is still going up, but for the sake of time and to be respectful of everybody's time, I want to go ahead and get us started for the day. Good morning, everybody. It is June 10th. It is summertime, hence my summer background. This is where I wish I was, which is, I'm just manifesting it's in Hawaii somewhere. So I am not actually in this lovely tropical place, but I sure wish I was. My name is Candace Bailey, and I am the HCBS Division Director within the Office of Community Living, and we are going to continue our discussion today around the Nurse Assessor. All right, next slide, please. Okay, so welcome. Said we were going to start promptly at 10:30. I started promptly at 10:31, so I'm already a minute late. But we are recording this, and this webinar or presentation will be posted to our website. Like all of our other presentations that we've done on Nurse Assessor, they are all up there, all live. You can review them all. Please use the chat feature for questions. We will do our very best to get to them, but we capture every single one. So if you happen to go to our website, which I highly encourage, please check in and see all of the chat questions that we didn't get to. Last number I saw for the listening log, we were at 411 questions and comments and responses. And so we take it very seriously to make sure that we address every single question and comment that comes in. And so please use that. If we can get to your question today, we absolutely 100% want to try, but there's lots of questions often, so we can't always do that. The slides are also available. We do have one slight update, which I think actually was updated yesterday on the website too. So if you were pulling or looking at the slides before yesterday, please go back and take a look at them again. There is a new addition to a slide that we had to update as of yesterday. If you're listening by the phone and have a question, please press *6 to unmute your line or *9 to raise your hand. So raise your hand first, and then I can call on you when we get to an appropriate stopping point. We also have closed captioning, so you can click the CC icon on the bottom of your screen. And then for more information, obviously, please review our website. Lots of plugs for the website. All right, next slide, please. All right, our mission, it's always good to start off and ground ourselves in our mission. It's improving healthcare equity, access, and outcomes for people we serve while saving Coloradans money on healthcare and driving value for Colorado. Next slide, please. All right, today's purpose. The purpose of this webinar is to communicate and engage with you all about our project. We are very close to launch, which is super, super exciting. And so we're just really working to go through some frequently asked questions and really engage with you all on the next steps. Next slide, please. Today's agenda. So we will do a quick recap of what we talked about last time, which included the timeline, criteria, and resources. Then we're going to walk through the case management agency process, the home health agency process, and then we have a lot of FAQs. So there's been a lot of questions that have come in repeatedly, which is great. And so we're going to walk through some of those today. We'll also make sure that they are posted on our website as well. And then we're going to talk about our post-implementation feedback process. Next slide, please. Okay, so quick, super high-level overview. Again, this meeting from May 13th was recorded. It is posted online. It is current and active. So if you were interested in more details around each of these items, please go ahead and take a look at that. You can at least look at the slides if you'd like. So we walked through the timeline. So when we talk timeline, how long does it take from when Telegen receives a referral to when they complete the assessment to when the recommendation letter is actually mailed out? So there's the 24 business hours for the referral. There's the 7 days for completing the assessment, and then 2 days from the assessment completion to when the recommendation letter is sent to the member. So we walked through all of that. We discussed criteria on in-person versus virtual assessments. So we had to create some criteria for Telegen for when they could determine in-person versus virtual. That information is online. You guys were super, super helpful in providing your feedback there. We also discussed the intake, express, and expedited assessments criteria. So what would qualify somebody for, as an example, an expedited criteria or expedited assessment. And so your input was super helpful in finalizing that information as well. Again, resources, we have the recording, so you can watch if you don't get enough of hearing me speak today. I actually recommend you taking a break from that, but you can listen to me speak again from last month. Our listening log, that is where all of the comments and questions are captured from the chat. And it is meeting over meeting. And so it goes all the way back to our first meeting at the very beginning of the year through, we will get today's updated after today as well. And then we have our assessment and acuity tool actually posted with a lot of information and a lot of one-pagers, some actual trainings and things that are really helpful. So I highly encourage, if you're really interested in understanding how the acuity tool works, please take a look at the one-pagers, the little trainings. There's some videos and things like that that are really, really helpful for understanding how to walk through it. All right, next slide, please. Okay, so this is hot off the presses, brand new. This was the slide that was added that wasn't there until yesterday, just so you know. Timeline change. So we have begun announcing, we sent out a couple of communications yesterday, and we're still finalizing and getting a few more sent out today. But despite extraordinary efforts on both Telligent's part and HCPF, we actually have encountered a few delays on some of the key components for the program. And so because of this, we're actually going to push it out a month. It is really important that everything is ready. And one of the things that we have repeatedly said that if it's not ready, we're not going to launch. And guess what? It's not ready, so we're not going to launch. We are working very closely, literally, I think I'm in at least about 2 meetings a day with Telligent. Their staff are working super, super hard. They're doing a really excellent job. But to make sure everything is really where it needs to be, we're pushing it out 30 days. So that means we're looking at an August 1st timeline instead of July 1st. So there's an extra 30 days. This small delay is really going to allow Telligent and HCPF to be completely confident that everything is working the way that it should prior to launch. Because of the dependency on the nurse assessor, the actual acuity assessment for the PARS to restart for pediatric RN, LPN, and CNA services, that is actually going to be delayed as well. Health maintenance activities, or HMA, is going to continue under the existing approval process until the nurse assessor is completed. So walking through this a little bit. So we have our health maintenance activities. Currently, everything goes through Telligent on the front end, or on the back end, I'm sorry. It's a utilization management process. That contract has been extended, and that process will continue as it has. No change around that process. It's just being extended for an additional month. The difference is, and hopefully there's a few case managers on today, is previously everything had to be to Telligent by, I think it was June 13th to wrap up and be ready to go live for July 1st. So there was going to be a little 2-week gap where case managers were going to have to hang on to a couple of things. We've actually extended the contract, so there will be no gap. So case managers will have until the end of July to submit their HMA reviews. Come August 1st, they will switch over to doing assessments for any upcoming CSRs or new members. So there will be no gap whatsoever, which is really exciting, and we're really happy about that. For the adult long-term home health members, and I'm breaking this up by groups because the way that the process works currently is a little bit different. Those PARs are currently submitted through Essentra, and that process will continue as is. So it's just another month of continuing as is. Same with private duty nursing, continuing as is. PARs are already required. They're already being submitted. They already go through the medical necessity review. That will continue as is. We are still on point for launching the pediatric therapy PARs, long-term home health therapy PARs, come July 1. We've had an opportunity to do the soft launch and the rollout starting February 3rd. Those are not dependent on the nurse assessor acuity assessment because it is not for therapy services. And so that will still launch July 1st. So all of those providers that have been working so hard, and I am just so impressed with the level of engagement and how hard everybody's been working. We already are well over half of the providers have done over half of their PARs. It's pretty amazing. So the therapy PARs, so those will continue as previously scheduled. And then the long-term home health, the pediatric long-term home health, intermittent nursing, and CNA services, those PARs will be delayed an additional month before they're restarted. All right, that was a lot on one tiny slide. Cassie, are there any particular questions that have come up around that that I could answer before we move on to the rest of today's meeting? Because I know this is a big announcement and this is brand new. Literally, I just updated the slide yesterday.
Yeah, excuse me. Katie has asked, could you talk a little bit more about what criteria we're using to determine if the system and the program is ready to launch?
There's not a list necessarily like this list of like 6 checkboxes, things that we can check off. It's really, there's several different portals for referrals and then input of information from the department. And it's really about making sure that the flow of information in and out is seamless. So it's really about going through the testing process for Telligent. They have built the acuity assessment in their system. They have gone through their hiring, that's all underway. All of those things are happening. This is really just around finalizing those and the fine-tooth comb of making sure the flows are seamless. And it's mostly around, at this point, testing that we are going to be extending. So the pieces are built, the portals are built, Qualitrack is there, it has the acuity assessment, their hiring is in place, in process, all of those pieces. It's just, we need a little bit more time really for the testing of the system itself and the various modules of the portal. So hopefully that explains that. Any other questions around that, Cassie, that you don't mind pulling out for me?
No, I think that's okay. There's some technical questions, but I think you can go ahead and move on.
Okay. So thank you for your patience on this. Again, we are really committed to operational excellence, and we've been saying all along that when things aren't ready to launch, we don't want to launch them. And so this is a testament to, we want to make sure this goes smoothly. And so we are delaying it to make sure that everybody is ready and things will go the way that they need to go. All right, let's move on from that. Next slide. This is what I was always planning to talk about, and none of this changes, which is exciting. And it's all really important information. So we're going to walk through the process that a case management agency will go through, and then we're going to walk through the process for a home health agency separately. So case management process for members that are currently receiving health maintenance activities, or HMA, through CDOS or IHSS and home support services. Here's a step-by-step process. So first, when you're scheduling the member's level of care assessment, they're then going to submit the referral to the nurse assessor. Again, keep in mind, this is all starting go live. So this will be starting August 1st. The nurse assessor referrals can be made up to 60 days ahead of the member certification letter. So if you do actually work 90 days ahead, you will have to wait an additional 30 days. But a lot of, I know a lot of case managers are on the 60-day timeline. The level of care assessment can be completed while the nurse assessor acuity assessment is also being scheduled and completed. So those can be on similar timelines and paths. They do not have to, one doesn't have to happen before the other. During the acuity assessment, if tasks are identified that are not considered skilled tasks, so remember the acuity assessment is for skilled care services, the nurse assessor will then complete the direct care services calculator. I just want to put a little note here that there are only 2 entities that will ever complete the direct care services calculator. It is the nurse assessor, and it is the case manager. At no point in time is a provider ever completing the direct care services calculator at all. That is not how that process works. I know there's been a lot of confusion, so I want to make sure it's really, really clear here in this meeting. Only the nurse assessor or the case manager will ever complete the direct services calculator. So just want to put that plug out there real quick. Then the second step here is once the assessment is completed, the case manager will actually receive the copy of the recommendation letter, the acuity assessment, and then also the direct care services calculator if applicable. So the nurse assessor will only complete that if there are unskilled tasks identified, or in certain rare occasions where the HMA activities are not fully captured within the acuity assessment. So it's not everybody will have one, just to be clear. Next slide, please. The third step, sorry, I love summer break. I have a child, she'll be fine. We left the dog outside, everything's fine. Okay, so the third step is after the receipt of the recommendation letter and the acuity assessment, and then the direct care services calculator, if applicable, the case manager is then going to complete the person-centered support plan. During this time, the case manager will discuss all the different service delivery options with the member, the services that they were assessed for, and how they can actually receive those. They will ensure and have a discussion on the non-duplication of services and hours recommended by the nurse assessor, and then finish the direct care services calculator if necessary. After that, so once the service plan is, or the support plan is completed, then the case manager will complete the PAR and submit that. For CDOS, the case manager will complete the monthly allocation and submit the prior authorization request to the FMS vendor. For IHSS, the case manager will send the direct care services calculator to the IHSS agency, who will then provide their care plan and submit that to the case manager for approval. The direct care services calculator and the care plan don't have to match. However, the service authorization obviously has to align. Next slide, please. Okay, so case management process, and I know that there's questions coming in, but I'm going to get through the case management process and then I'll pause before going into home health agencies and we can talk through some of those questions. Case management agency process for new members. For anybody newly enrolling into Community First Choice that is also interested in health maintenance activities through CDOS or IHSS, the case manager is first going to complete the intake process for CFC. Once the member is financially eligible for services, then the case manager will place the referral for the nurse assessor. A referral must wait until the case manager receives the approved financial eligibility. So the member has to be financially eligible before that referral is sent. Once the referral is sent, the nurse assessor will contact the member, schedule the assessment, and then again, the same process. If additional non-skilled tasks are identified, the nurse assessor will complete the direct care services calculator. Next slide, please. And then the same process here. After they receive the recommendation letter and the calculator, then the case manager will complete the person-centered support plan. The case manager will then follow the enrollment process for either CDOS or IHSS, and then they'll submit the PAR as necessary. Next slide, please. Great. Okay, we're going to pause here. Will you go back one slide?
Candace,
yes.
Question that came in, and I think maybe rephrasing a little bit of, because I think the confusing part is like start dates. People with start dates of X, Y, and Z. I think that kind of depends on when and how the case managers work their workload. Mm-hmm. Can you talk a little bit about when case managers might start using the nurse assessor process, mm-hmm. And potentially what start dates those can be? I just think the start date part might be making things a little confusing.
Yeah, those are great questions. Okay, so the nurse assessor process will begin. So case managers can begin making referrals to the nurse assessor on August 1st. So that means any new member with a start date of August 1st or later can go to the nurse assessor starting on August 1st. Case managers typically work 60 to 90 days in advance of the member's certification end date. So for an August referral, they will be working on their October CSRs, continued stay reviews. So it will be those that have their end dates in October. The case manager is going to be doing their work for the CSR in August, and that's when they would be submitting the referral. So it would be start dates of, what is that, November 1? No, October 1, sorry. So the end date would be September. So October 1 start date, or potentially November, depending upon how far in advance the case managers work. But October 1 start dates, the referral goes to the nurse assessor in August. Does that help, Cassie?
I think so. We'll see what, if anyone in the chat wants to say that does or doesn't help.
Candace, I'm going to ask the obvious question. What do people do with start and stop dates before those dates? Should they follow their normal process that they have been doing, or is there an interim process?
I promise I didn't plant that question, friends. Yeah, great question, Katie. So they will continue to follow the process they have been. There is no interim process. There is no new process. There is no, just for these 2 weeks, you're going to do this. It is continue to do what you have been doing all the way up through July 31st. So there's not even a pause where there's a little gap like there was originally going to be a gap for HMA. It is all the way through July 31st. And then August 1st, it is a clean switch over. Thank you, Katie, for that question.
And Candace, just to even further hit this home, CFC begins July 1st.
Correct.
And with the implementation of CFC, things will still continue to be authorized and processed as is, even though that's starting 7/1.
That is correct. That is correct. All of those timelines, all those processes will stay as is, as they have been. With CFC, they will plan and they will switch over to CFC following those processes July 1. All of that will stay the same until August 1st. But we really, really, really did not want to introduce an additional new, super short interim process because that just makes things much more complicated. So we're just pushing things back, if you will. Other questions specific to health maintenance activities and case management agency processes? Great, let's move on. Oh, there was a question. Deborah, did you have a question?
Just really quick, I'm so sorry I hopped on a couple minutes late. So will the nurse assessor be filling out the direct services calculator with the HMA tasks if they are evaluating them for HMA? Will that actually get filled out by them so we know what hours they were planning to allocate for each task?
So they will not be completing the direct services calculator for HMA unless in their assessment process and their conversations with the member, the acuity assessment is not appropriately capturing what their HMA needs are. So there may be a few rare instances where the HMA tasks are going to be better outlined and captured using the calculator. But for the most part, because it's skilled care, so the acuity assessment was built to assess for anybody's skilled care needs. RN, LPN, CNA, any individual that has a need for skilled care services, it was built for that. If there is a rare instance where something is being missed, then they would complete the direct care services calculator for HMA, but only in those cases.
Okay, so will the case management agency complete the direct services calculator, the HMA piece, so they can share that with the HHA or the IHSS agency so we know how to write our plan of care to match? So if we just have a lump sum numbers, we could come up with a totally different way to allocate those in a different amount of time for each of the tasks than the case management agency is actually planning to approve. So that was sort of the way that we communicated together to make sure that our stuff all aligns and matches up. So if we just have this number, we could be looking at it totally differently than the case management agency. And that's where I think there's a communication gap, and I'm worried about how that's going to look.
Understood. I have Erin Thatcher on the line who is here to help with answer that question. Oh, Erin, I can't hear you. I don't know why. Your mute is off, but I can't hear you. Nope. Deborah, these are great questions, and Erin is very excited to answer them. But
I see that.
Okay, sorry. Are you
there we
hearing
go.
me?
Yes.
Oh, you guys, we have a system mute problem here at
Oh,
HitGov.
yes.
Hi, everyone. Erin Thatcher. So from the agency perspective, we know that agencies need to develop their care plan with the information that the direct care services calculator and the case manager gather. Things may not match 100%, and we know that. We really just need to make sure that agencies are following the direction that the case manager is providing them and the information provided. So in short, the DCSC is available. We posted a link in the chat. It's online. You can look at it, but we need the case manager to send it to you, and then you'll complete your care plan and give that back to the case manager in order to get the PAR. If I missed something else, please let me know.
So if I could just let you know what's happening on the ground right now. The case management agencies, I apologize. I think it's just been overwhelming. Don't know what's going on. I have been on every single call with every CSR review talking about these direct service calculators, how they work. What does accompanying mean? What does accompaniment mean? We've walked through every single one, and I've done a lot of education. I feel like the case management agencies, somehow there's been a gap in knowledge and training And I'm just letting you know that. So basically, as an IHSS agency, it's great to say they should fill that calculator out and send it, but we're sending a whole bunch of information back and providing a lot of additional details. So unfortunately, I feel like they're not exactly the experts at filling out the direct services calculator. I feel like I'm more apt to be able to do that more accurately at this moment. So I just want to let you guys know that's what's actually happening. So I don't know if we can provide some additional training and support, because I physically can't do that for every single patient that we have.
Yeah, absolutely. And we will for sure take that back, work on some training and support for the case managers. It is 100% not for providers to fill out, so you should not be filling it out at all. I do know that there's been some confusion around that, but we will work directly with case managers and provide some additional training there. So thank you for the feedback.
Right. And just so you know, we haven't been filling it out. We've just been telling them what to fill out.
Yeah, understood. Understood. I do know that there are some provider agencies that have been filling it out, so that's why I'm trying to make sure that the message is very clear, because I think there's just been some confusion. They think it's their role. And so just making sure everything's super clear, but I appreciate that feedback very much.
Ours is a collaboration for sure.
Thank you. That's good. I like that. That's much better. Angela.
Yeah, I appreciate that you said this, because we unfortunately are having a really hard time with many of our agencies demanding that they have to fill out the DCSC, refusing to even listen to the case manager. I appreciate what Deborah has to say. Unfortunately, we experience it on the other end. And so I would like to advocate for the case management agencies that these case managers are doing an excellent job and the best of their ability. And unfortunately, they're finding some very difficult situations with many of the agencies, refusing to even begin to collaborate or listen or have conversations. And so, it's just kind of sharing the other side of the coin,
Yep.
I guess.
Yep.
There's always two sides to every story, right?
Yep.
And so I do think there needs to be some work done in that. And we are definitely trying really hard from a case management agency perspective to educate, talk to these agencies, talk through, what we're being told. But I think there's definitely, I think maybe we're hearing different things. I'm not sure, right?
Yeah. I think there's, as you point out, there's two sides. And so appreciate that. And I think there is a lot of clarity that needs to come out for folks to understand. And so that's what we're working to do from both sides. And so the collaboration is key. Deborah, I really appreciate that. And Angela, we are working to make sure that everybody understands whose role is to do what. And really, ultimately, the main number one thing is working together to support the member. And so I think we'll get there. Everybody is under a little bit of stress and pressure, and we'll get there.
Thank you.
Yeah, thank you. All right, let's move on to the next slide, please. Oh, just kidding. Jim.
Yeah, I'm just confused a little bit about the process. And so the nurse assessment has 7 days to do the assessment, and then they send something to the case manager, and the case manager fills out the calculator. As a participant, do we see anything before it goes to the case manager?
Yes. So the recommendation letter and the acuity assessment will all be accessible to the member. There, you can either pull it down from Telligence Portal directly if you'd like, or they will mail out the recommendation letter to each individual member. So the members always get a copy of it, so they understand how they were assessed and what the recommendation is from the nurse themselves. The case manager also gets a copy, especially when we're talking health maintenance activities, so that they can then move forward with their care planning and prior authorization requests that are necessary to be submitted.
So, CDAS has got 3 or 4 types of services. So once the nurse assessor does the health maintenance, it gets the case manager, and then the case manager is going to fill out the calculator to do all the other ones, or do they work with the participant for?
They should always be working with the participant. So when they're completing their person-centered support plan, it is conducted with the member to understand what their needs are, what their desires are, and creating that care plan with the member. 100%, it is always with the member.
That's good. So the new thing, though, is now there'll be some recommended hours from the nurse assessor for health maintenance, but they'll also potentially have recommendations for services in the other areas based on their assessment, the health maintenance, things that aren't coming in.
If there are some unskilled needs that are discussed during the assessment itself, then the nurse will note those, create a part or a full calculator, depending upon how in depth they go into those needs. So that the case manager will have that information as well.
Okay, good. Thank you.
Yeah, of course. Thank you for the questions. Tara.
Can you hear me?
Yes.
Perfect. Thank you. Hi. So quick question. So when the recommendation letter comes back and we complete our assessment on our end, right? And we determine that there's a discrepancy in the recommended hours. So when we submit that back to the CMA with additional or fewer hours, however that looks, who is going to then be reviewing that to approve it? Is it going to be the case manager, or is it going to be somebody who's a little bit more qualified?
It will be the case manager. If we're talking health maintenance activities, it will be the case manager and the case manager's supervisor.
What if it is CNA or anything along those? That would just go straight to...
No, then that goes to a center for medical
Accenture.
necessity review.
Okay, perfect. I just wanted to make sure that I understood the separation between the two. I appreciate it. Thank you.
Yeah, of course. All right, I've attempted to move on multiple times. I think a little too soon, so apologies. So before I move on, any other questions? Okay, all right, let's go to the home health agency process. Okay, so walking through, same idea as the case manager. So we're going to walk through the step-by-step of what this looks like for a home health agency. So the home health agencies must complete the mandatory training for nurse assessor referrals. So everybody has to complete the training within the QualCheck system. There has to be some authorized, it's an authorized user essentially that is going to manage the agency's other users and making sure they can reset passwords, but they have to go through a training for that first. The first one was actually yesterday. And then once you've done your training, you can begin making your referrals to the nurse assessor. So this will be required for any new and existing long-term home health and private duty nursing members. So it's anybody. It's not just one particular population. It is anybody for nursing services of any kind, private duty nursing or independent nursing, and certified nursing assistants. Referrals are required for, I just laid that out. It is not the therapy. So the nurse assessor process is not for long-term home health therapies. So that continues to follow the process it always has. For current members, referrals may be submitted up to 60 days before the expiration of their existing PAR. For the pediatric members that don't have a PAR, then you don't have to worry about that part going forward. Once they do, you will have to manage that because this will be an annual requirement for each member. New members will not have a PAR in place, and so referrals can be made at any time beginning August 1st. Then the next step is the nurse assessor intake call. So Telgen will contact the member to gather all the necessary information and then work with them to schedule the assessment. This fourth step is that they will conduct the assessment. Next slide, please. The fifth step is then they receive the recommendation letter. So the nurse assessor will send the recommendation letter to the member and the home health agency, which includes the suggested services and hours in the documentation. The home health agency must also complete their own assessment. So you're still going to be required to complete your licensure required assessments. So start of care, recertification, all of those pieces. Those are required by license, and those are still required going forward. This acuity assessment is really there to determine what level of services are necessary and what is recommended for those services. The home health agency will then submit the prior authorization request, the assessment, the plan of care, and all the required forms and documentation to the vendor, who is currently Accenture, via their Atrezo portal. So you will take all the normal documentation plus the recommendation letter and submit it to Accenture. The home health agency may request hours beyond what the recommendation letter states, as long as it's clinically justified. So if you have the documentation showing that level of skilled intervention, great, and it's necessary, then ask for it. Those pieces will be reviewed by Accenture. They will be looking for that skilled level of intervention. Number 7 is then the PAR is reviewed and a determination is made. I think that, and then that is the last slide on this. So let's go back one. And I think we have a few questions on the home health agency process. So Cassie, I know we have a hand up, but I want to see, is there some in the chat you want me to talk through first?
Go ahead and do the hands raised and then we can go to the chat.
All right, Bushra, how can I help you?
Yes. Do we have a timeline on when our own start of cares need to be completed or submitted after we receive the recommendation letter?
That is a licensure requirement, and Christine Merriman wants to answer that question for me.
Sure. So all of those timelines for submitting your documentation remains the same. So the 10 days for a prior authorization, and then if you have adults and you have to submit OASIS information, and all those timelines are staying the same.
Okay, thank you so much.
Mhm.
Yeah, great question. Thank you. Katie.
Yeah, thank you. I wanted to ask a question that I've seen in the chat a couple times and that I also asked, which is, when are we going to know more about what's included in the recommendation letters, what the requirements are for those recommendation letters, and will they include, the sort of specific scoring of the tool? Here's what was put in and here's what came out, and that sort of stuff. Thanks.
Yeah, great question. So we are hoping to have a sample of the recommendation letter posted for folks to look at to our website soon. We were hoping to have it today, obviously. As we mentioned, there's a few things delayed. So we will get that out as soon as we can for folks to see the information that is in there. It is not going to have a breakout of each, let's say, body system. So 3 hours for breathing, 6 hours for feeding. It's not going to have a breakout like that, but it will have it broken out by service type. So certified nursing assistant and RN, if that makes sense.
So just to clarify, it means the member's not necessarily going to know what the nurse assessor put in to get that service type. And I'm partly asking because if as a member, you think, oh, you know what, I forgot to tell my nurse assessor this part. How do I go back and know that what's the process for me to be able to talk to the nurse assessor and correct something if I don't know what they've actually put in?
Yeah, so they will have a copy of their assessment itself. So they'll get a copy of the completed tool, which will see how they put or added in information, where it is, and they will have access to see if they feel like something is missed from that piece. So they'll be able to see the assessment itself, and then separate is the recommendation letter. So they will have access to that. Additionally, if they realize, oh, I totally forgot to mention this one really important component, which takes me 2 hours every single day to complete for, my son or daughter, they can also work with their home health agency and add that information with a justification that the home health agency can request on the part as well. So it's not an end all be all. Like, things get missed, it happens. And that's why there's the process for allowing additional hours when necessary and justified to then be approved. And I see, I have Katie's hand up, so I think she wants to add to that too.
Yeah, Candace, that's a great answer. Thank you for that. The only thing I would add, Katie, is that the nurse assessor assessment is interactive. The nurse assessor is going to be interacting with the member and whoever else they choose to have at the assessment with them. So it's not going to be a blind assessment. So it's a new program here in Colorado. So I just want to remind people that it will be interactive. So the member will be involved from the beginning. And then Candace brought up a great point. People forget things sometimes. So there's an opportunity within the assessment where they can go back and change it. There's also an opportunity within the assessment if there's potentially something Candace was talking about that we didn't cover but is meaningful, and they can add information about that. And then remember, the nurse assessor assessment is a recommendation. If something changes in between the recommendation letter being produced and then the submission of the PAR, stuff happens. We tried to account for, all of those outlier situations that do happen. The home health agency that is providing the service and the member definitely have the opportunity to provide clinical documentation to support the change when they submit the PAR then too.
Thank you, Katie. And I there's a lot of questions popping up, but one that really stuck out to me that I want to address really quick before I get to the other hands is the question was along the lines of what if the nurse assessor recommends HMA, but the member doesn't want HMA? I want to be clear that that is never going to happen. So the nurse assessor is not recommending a service modality. The nurse assessor is not saying, hey, I think you should self-direct these services. The nurse assessor is going to recommend the level of service, whether it's a CNA level or a nursing level, and that level of service. And they're going to provide education so that a lot of people don't realize that they can have their services self-directed, that they can control and direct their own care, even when it's skilled care. And so it is an education piece that the nurse is going to be conducting, but they are never pushing a member to go down a self-direction path. It is 100% the member's choice. So I just want to make sure that is super clear out the gate, that is not their role and that is not what they will be doing. Katie has her hand up again, so I'm going to let her jump in.
Oh my gosh, Candace, you're bringing up such good points. So I just want to reiterate them too. Self-direction is an amazing option. It is something that the member gets to choose to do. And oftentimes we're finding that a lot of our members don't even know it is an option,
Right.
Especially for those people who live in deserts for home health agencies, like in the rural setting, or even sometimes just a frontier setting as well. It is a great option for members to get skilled care if they don't even have access to a home health agency. So I just always want to remind people of that.
Thank you, Katie. All right, I'm going to go to a couple of hands that are raised, and then I know we have a lot more comments in the chat, so we will go through those as well. Susan.
Hi, I just had a couple of questions. How do we get the letter from the assessor? Does it come to an email within our company? Does it get faxed?
So it will be in the Qualitrack system, and that is where the training comes in and why everybody has to have the training. So each agency will be trained, and you can pull it down directly from the system.
Okay, great. And then, right now we're doing obviously the private duty nursing, and when we have those one-offs where they get denied, they go through the appeals process. Is that still the route that would happen with the CNAs? In the past, that's what was happening. They would have that appeals process also.
Yes, the appeals process stays the same. So it is through the medical necessity determination, and it is during that process that a member has the right to appeal. The recommendation letter is just a recommendation. It is not a denial in any way, shape, or form. And so once the recommendation, the assessment is done, home health agency submits all their documentation. It then goes through a full medical necessity evaluation by the vendor, Centra.
Okay. And then is the Centra getting the recommendation letter also? I'm sorry, I didn't.
The home health agency will be submitting it with their documentation.
Okay. Thank you.
You're welcome. Great questions. Irina.
Hi, Candace. How are you?
I'm good. How are you?
Good, thank you. Do you mind going one slide back? I believe it would
Not
be
at all.
slide 12. Could you please clarify number 2Ds, David? New members will not have a PAR in place. Referrals can be made at any time.
Yeah, so new members don't currently have a PAR. And so the whole point of this, because some of the previous ones, for example, C says that the referral is made up to 60 days before the expiration of the existing PAR. Because there is no PAR in place, you can't base it off of that. So there is no, you have to do it within the 60-day timeline. It's whenever you have the new member, that's when you submit. After August 1st, that's when you submit the referral.
Just to clarify one more time, for the patients, for example, for home health, let's say we have, one of the exemptions under the state rules that we have, nurse for med plan is set up most often happening once a week, right? Those patients usually go to long-term PAR, right?
They would have a PAR in place, yes.
So we're still following the current rule. What happens as of August 1st in those situations?
Everybody that has long-term home health will need a nurse assessor.
Right, but the time frame, because we have 10 days to submit the PAR from the start of care, but with the time frame that is set up with the nurse assessor may not always, fall into those 10 days, how would the provider submit the part then? Because we need to submit the nurse assessor assessment with it. What if nurse assessor assessment has not been completed yet, but the 10-day allocated to the submission of the initial PAR has gone?
Right. So for long-term home health, don't forget you have the acute period. And so anybody that is beginning services has the 60 days acute period, and you utilize that. If you know that they are going to move into long-term home health, then you would work on that process to get the assessment or the referral submitted so the assessment can be completed before that 10 days of starting care.
Okay, so I think it contradicts the rules a bit, and I can email you separately what specifically.
Yeah, maybe
I'm
if you
referring
email
to.
me, we can line it out because
Yeah.
With long-term home health, you have the initial acute home health period first, which is 60 days. And if you know somebody's going to move into the long-term home health, that gives you plenty of time to submit the referral and get that completed.
Okay, sounds good. Thank you so much.
Yeah, of course. Katie, did you want to add to that?
Yeah, Irina brought up an example that's come up before when we've been going around and doing education on the nurse assessor. This is new, and we have created a model that is like a no wrong door model for the nurse assessor. Prior, it has been so heavily focused on the home health agencies. And so, Irina, this is going to be more of like a medical home type model as well. So like if a PCP has the member, they're in the clinic, is assessing them and is like, man, they're going to need some long-term home health. I don't think that they qualify for acute home health, or the same. If they're currently hospitalized and we're thinking they're going to need some type of in-home support, those two teams that are involved in the medical home of that member have received education on the nurse assessor referral process as well. And they too are going to be invited to come along with you guys to the television trainings that are going to be happening in July as well. So, I had operational oversight over a home health agency for several years, and I feel like you guys carry a heavy weight for that. So that weight is going to be better balanced throughout the medical team that's helping provide care for that member going forward. I hope that helps a little bit.
Thank you, Katie. Colby.
Just to kind of piggyback, I guess, actually off of Katie's stuff, which is good, is there a process for kind of checking any duplication requests to the nurse assessor? Just because if we're looking at, we had the list from Paul that was back from February for the, continued state reviews that we're trying to work backwards with and stuff.
Mm-hmm.
And if we're trying to submit something and then potentially a case management agency is submitting it to the nurse assessor at the same time, how is that? Who's going to get notified and what's that process look like?
Yes, that's actually part of the system that Telegen has built and is finalizing, is to checking for multiple referrals for a single individual. So that is part of what they have, and they will be able to check for that.
Perfect. Thanks.
Yeah, great question. Tara.
I know that I've asked this question before, and there wasn't an answer at the time, so I'm hoping maybe there's a little bit more movement, but is there going to be more education given to some of these case management agencies or maybe other individuals that are submitting the referrals to the nurse assessors for adults that may need nursing services that go beyond the acute period for how to access long-term care?
So case managers will receive specific training on submitting referrals. I'm not sure I fully grasp your question when it comes to specific to adults needing long-term
So
care.
if an adult is needing, let's call it CNA services.
Yep.
And if they do not have long-term Medicaid, we can
They don't
only
have long-term Medicaid at all.
Yeah, let's just say they don't have long-term Medicaid, right? So they're referred to the nurse assessor. We can only cover them for that acute period. So if they need to go long-term for those services, they would need to be a part of the long-term care Medicaid, right? So is there going to be guidance through the case management agencies on how to get them there, be it through waiver services or any other means?
So they wouldn't need a waiver to receive long-term home health services.
No, but long-term care Medicaid.
The long-term care Medicaid is actually, that's often referred to long-term care Medicaid is usually for nursing facilities or institutional placement or the waivers. The rest of Medicaid is Medicaid. It's Title 19. So long-term home health services fall under that. So they wouldn't need a separate Medicaid eligibility type. If they are traditional Medicaid, they just stay in traditional Medicaid, Magi or otherwise.
So Magi will cover
Mhm.
long-term home health beyond the acute care period?
Correct.
Good to know.
Yeah, it's a state plan benefit, which means it's available to anybody that has standard regular Medicaid.
Perfect.
Great. Deborah.
Okay, so I'm sorry, I'm a little bit confused. So right now we have our list of CSR dates.
Mhm.
And I thought originally beginning with 7/1 CSR dates this year, we would be submitting those CNA PARs, so they don't have PARs currently for long-term home health. So these are patients that are getting long-term home health, but don't currently have PARs, that we're supposed to be submitting those to Essentra to stay in line with their CSR date to obtain PARs for those. Is that still correct? Or are we now waiting till the nurse assessor assesses to be able to submit anyone to Essentra?
Yeah, so you always have to have the assessment before you submit them to the center for those pediatric patients in general. And that will start August 1st. So the idea was to align the CSR dates where possible, because it makes everything easier for everybody when there is one alignment date. It's not always going to be possible. But yes, you have to go through the nurse assessor process prior to submitting the prior authorization request and medical necessity review to Essentra.
Okay, and we can start making those referrals 8/1 now.
Correct.
So we'll start making them then, and we'll try to align CSR dates moving forward.
Right. And one thing I didn't mention was the original timeline was 7/1 through April 6th to get all of the PARs in.
Right.
Because we're pushing it back, we're literally just taking that timeline and pushing it all back. So now it's going to be 8/1 through, I don't know if it's May 6th, but I'm making up a date, but like the beginning of May. So we are making sure that we're not cutting down the timeline that you guys have to get all those PARs in place. It will stay consistent. It's just all moving back by a month.
Okay, and just to clarify that end date, is that the date that it needs to be submitted to Essentra for approval, or is that the date that the PAR needs to be dated for?
The date that it needs to be submitted to Essentra.
Okay,
Wait, no,
so
sorry. Sorry. So you have to go through the nurse assessor first, starting 8/1 to Essentra. So when we're looking at PARs, the PARs all need to be in place by the beginning of May. So that means the start date for the PAR. Yes.
Okay, so those CSR dates, obviously toward the end of next year, are not going to be aligning.
They're not going to perfectly align, no.
Okay, and then with IHSS for HMA, so is Telegen going to continue to review until the end of August? So basically, we're going to start with Nurse Assessor 9/1 CSR dates? Okay,
Nope, they are going to continue to review until the end of July. So those will also start 8/1.
Okay, so
it's just a 30-day, it's just everything's pushing back 1 month.
Okay, gotcha. So really the nurse assessors will be assessing any HMA for CSR dates of 9/1 and beyond.
Most of them will be 10/1 and going out, because 9/1, usually those assessments are done in July. So they're usually 60 days ahead, the case managers. So those CSR dates, and those dates have to align, obviously, because it's waiver services. But no, it would be 8 or 10/1 start dates.
Okay, thank you.
You're welcome. Megan.
Hello.
Hi.
So question about the PAR sort of timelines. One, because most home health PARs are for 12 months, I'm a little concerned that I was already concerned that they were kind of being weighted into 9 months of the year. So you're essentially having like 3 months that are not, that no PARs are being submitted. So you're gonna have this weird 3-month gap of when renewals are due, kind of ongoing, that will only be alleviated by brand new ones coming in. So, and my understanding was that was kind of, it is what it is because that April 6th date was unmovable. but it sounds like the April 6th date isn't necessarily fully unmovable. So why are we at this 9-month timeline instead of making it a year timeline that would make it smoother down the road too?
So the April 6th date to move that is not ideal because we are reprocuring that contract. And so you want to get through all of those reviews prior to switching over vendors if we're switching over vendors. The reason why we have agreed to move it back is because we did not want to shorten an already short timeline for these providers. It's already going to be a difficult short timeline, and therefore we didn't want to make it even harder and put more pressure on the providers by shortening it even further. So we are truncating the other end of things, not ideally, but to be clear, none of this is exactly perfect or ideal. And so we are moving that back to do the best that we can to not make it harder on these providers. As far as that 9-month timeline, providers are not required to do a full year. And so I know when I was a case manager, if I had 10 intakes in a month plus my regular CSRs, I would make those end dates stagger so that they could even out throughout the year, and home health agencies can do the same thing.
But if we're moving that April 6th a month, I guess my question is, why can't it be moved to provide a whole year timeline?
Because that's going to be the transition time for transitioning to vendors.
Okay.
All right. We have about 30 minutes left and I still have quite a few slides. So let's move forward. And that way I have a chance to answer a few more questions too before we end. There we go. So these are really key. So these next few slides are some frequently asked questions that we have received, which have come up enough that we really wanted to make sure we had a chance to address them with you all. So the first one is, will Telgen be completing a new and independent assessment, or will they use past determinations to make the recommendation? The assessor will complete a new assessment each year. So every year it will be brand new based off of that member's needs at that point in time. They can look at and they will have the previous year's records for review, but the recommendation is going to be based off of current assessed needs, just like what the case manager does for the level of care assessments. What is the turnaround time for an assessment and recommendation? Telgen is required to complete the intake call within 24 business hours or 1 day, and the full assessment within 7 business days. And expedited assessments, so for discharge planning, must be completed within 72 hours. The recommendation letter must be, and I see it's not written here, they have 2 days to get the recommendation letter out after the assessment is completed. How will the member be fully evaluated? I'm going to go through some of these before we jump into some additional questions real quick. So how will the member be fully evaluated with proper assessment via telehealth? This one has come up several times. The purpose of the nurse assessor assessment is they're really assessing and will share recommendations for skilled care services. It's different. It's very different than a physical hands-on assessment that involves a visual and physical examination followed by care planning. This is an assessment completed by trained clinicians at Telgen who know and understand how to properly assess a member virtually. So it is a different type than a physical hands-on examination, just to make sure that that's super clear. Next slide, please. All right. Will there be Spanish-speaking nurses or translation services available? Yes. The answer to that one is yes. Telgen will be able to provide free interpretation services. If an interpreter is needed, that can be indicated on the referral form prior to the intake call. Additionally, HICPUF has free interpretation services as needed and is not limited to Spanish. Efforts will be made to determine and prearrange all these needs for or ahead of the intake call, just so everybody is aware. And then, do you have to submit a new referral for members that are already receiving services? Yes. Even if a member is receiving services, a referral will be needed in order to complete the prior authorization. If the agency is submitting a referral, is there a place to add attachments such as GI notes and G-tube for G-tube patients or pulmonary notes? Yes. Yes. It's a really cool feature. I got to see it as a demo the other day. Is the QualiTrack system has a way to upload any relevant documents, which is really cool. And everybody's encouraged to actually use that upload feature when possible. You're not required to, but it is super helpful for a nurse to be able to have those documents to be able to assess somebody. Next slide, please. All right, do case managers need to submit the referral to Telgen in a certain amount of time? Case managers are expected to submit the referral in advance of the start date of the new support plan year. And then also keep in mind the referral must be submitted with enough time for the assessment and subsequent service planning process to take place. It's recommended 45 to 60 days in advance of the end date, so the end of the certifications period. If a current member needs a revision to their PAR, will the home health agency need to submit a referral to the assessor? If a member is seeking to adjust their hours to their currently authorized service plan, they would not need a new assessment. They only need a new, they would only have to go through a center for a new medical necessity review. If a member is seeking to change the level of services, so they're going from CNA to, for example, private duty nursing, a new assessment would then be needed for that. Next slide, please. And I promise I'm trying to get through some of these so we can get through the questions here. I only have a couple more of these, but these are super helpful. Who is sharing the recommendation letter with the provider agency, the member, or Telegen? The recommendation letter is actually provided by Telegen to a variety of entities, the health agency, the RAE, the case management agency. It's actually in their system. The letters will be housed in their IT platform called Qualitrack. The member, of course, can also share the letter if they would like, but Telegen will be sharing that information. What information will be contained in the recommendation letter? We talked about this a little bit earlier. It will not include detailed times for skilled care tasks, but it will have the outline of the overall recommended time needed for the skilled care needs, so the total time. The assessment will also be available for members to provide additional information and inform the service planning process. Will there be clear guidelines on what counts in changing condition? Yes, clear guidelines on what a changing condition. So when you would need a new assessment from Telegen will be provided to everybody. Next slide, please. Will non-skilled care also be determined by the nurse assessor in the recommendation letter? This one gets really tricky, and we've been asked this several times, and there's a lot of confusion around this one. So the nurse assessor is not required if a member is only seeking or only needs non-skilled care services. So if a member only has, as a for example, homemaker and personal care, nurse assessor recommendation that referral is not necessary. It is not needed. That individual, those members, any services that are non-skilled, assisted living, any of the residential services, homemaker, community connector, supported community connections, all of those, adult day, those services are not needed to go through. They do not need a nurse assessor referral. The case manager conducts the service planning like they always have. If, however, the nurse assessor, if there are skilled care needs that are necessary and a referral is conducted and the nurse assessor determines that there are services that are unskilled, they will outline those in the direct care services calculator. So again, if it is no skilled care services necessary, no referral is needed to the nurse assessor. Only if skilled care services are needed will a referral be needed to be submitted. All right, next one. Will there be a way for families to access the recommendation letter online or email or via portal in case they lose the physical paperwork? Yes. The answer is yes. It's great news. Telegen has a system called Qualitrack that a member can actually create their own profile, so they can get in, they can see all their past assessments, recommendation letters, and all of the things, which is really nice. I know I much prefer an online system because I'm terrible at keeping paper. So it's super helpful, and that will stay in their system. Next slide, please. This is my last slide of FAQ so that we can then get more into the questions here. Can the agency complete the direct care services calculator? We talked about this a little bit, but no, agencies do not complete the direct care services calculator. That is not a thing. It is not necessary. In fact, it is not valid. The only two entities that complete the direct care services calculator are the nurse assessor and the case manager. That's it. Nobody else. Hopefully that's becoming very clear. What if the IHSS agency disagrees with the nurse assessor recommendation or the direct care services calculator? Are there agency appeal rights? No, agencies don't have a right to appeal if they disagree with the case manager's determination for services. The case manager conducts a full assessment of all of the member's needs and also their desires. Just because an agency says, hey, you could probably use help with this, the member may not want that. They may have somebody else that they want to come into their home to help them, or maybe they're just not ready for that level of support and individual into their own home. That's okay. And so the agencies there is no appeal right. And then the last one is, how do I get health maintenance? I said home health, health maintenance activity services. It's a skill component of self-directed services. In order to access these, the member needs to be assessed by the case manager for community first choice and then referred to the nurse assessor for that assessment. Okay, I ran through those FAQs super quick. Good news is this is posted online, so you can have access to go back and refer back to these anytime that you need, and we'll continue to get, we'll actually create an entire FAQ section on our webpage that we will continue to update, much like what we have for the private duty nursing section. All right, we are going to go through some questions. We have a little bit of time left, which is ideal. Greg, you've had your hand up and have been so patiently waiting, and I appreciate it.
Oh, thank you. I appreciate everything that you're doing for us, for sure. So I'm with Maxim Healthcare in La Junta, the rural desert, as you guys mentioned. Well, I have two questions, but the first one is there going to be any chance of delay with assessments in our area?
No, it is a requirement that Telligent is able to conduct assessments statewide.
Okay. And then you had said for current members that we have, we can actually do 60 days before the PAR is due to get it to the nurse assessor. And et cetera will accept those assessments 50 days prior to the PAR ending, or will they require us to try to do something more current?
You'll have to have the PAR. You can't start a PAR because then you'd have overlapping PAR dates.
Right.
So if your PAR,
we have to wait until the actual PAR end date to actually submit it. But
well, you don't have to wait to submit it, but you have to have the start dates aligned. Does that make sense?
Right.
Yeah.
So like if it ends, let's say I have one right now and 10/1 or 10/31 or 10/31, because there's 31 days in that month. 10/31.
I had to think about that too. I'm like, do the math on the numbers, right?
If I have one ending 10/31, and let's say I go ahead and let the nurse assessor September 3rd, September 4th, let them know, hey, we're getting ready for this PAR that's going to end on this date. And let's say we get the nurse assessor's assessment, they're going to accept that assessment even though it's 40 days, 50 days earlier.
Correct.
Okay, that's what I was checking. Thank you.
Yeah, of course. Great question. Jessica.
Thank you, Candace. I just wanted to clarify on the revision. Did I hear you say that for a revision that would not need to go to the nurse assessor, specifically talking in terms of IHSS HMA?
If it is just a revision for hours and not for changing in the level of service. So for HMA, you wouldn't need to go through the nurse assessor. Again, if you're looking to go from HMA to private duty nursing, for example, then a new referral would be needed.
Okay, so for HMA, if we're just increasing hours mid-PAR, that would not need to go to the nurse assessor.
Nope, there would have to be obviously documentation as to the reason why and an opportunity for the case manager to be able to document that, but no, it would not need a new assessment.
Okay, perfect. Thank you so much.
You're welcome. Pat.
Hi there.
Hi, Pat. How are you?
I'm good and totally confused and overwhelmed with all this. I must say, as a consumer, as a family member, the process that somebody with IDD to enter the system seems like there are so many barriers that very few people are going to be successful in accessing the needs, the services that they need to take care of their needs. Somebody from HICCUP needs to look at people with IDD and entering the system and make this a less complicated process. I really think that it's so overwhelming that all families cannot access all of this information. And if they're members with IDD who don't have families as strong advocates, then it's going to be impossible. But my specific question is this: on the DD waiver in your listening log, it was said that the nurse acuity tool still has to be filled out. Is there a reason for this, since nursing level care is waived in the DD waiver?
So it is when a member is in the DD waiver, if they need private duty nursing, they would have to have this acuity tool completed as well. Anything under private duty nursing or nursing services, so for example, CNA, that is part of the per diem service for the residential. So the nurse assessor is not needed for that because it is already built into that tool. It is a separate process. I also want to just comment on the complications for an individual to get into the system. We're hopeful that this actually makes things easier because there are fewer steps and a one stop and one opportunity for members and their families to learn about all of the different service options instead of having to go to 3 different entities at one time. So this is actually meant to streamline things and make them a little bit easier. It's new, it's overwhelming. I hear you. And we are going to work to continue to simplify things, but this is actually one entity versus 3 potential entities at this point in time. It is actually streamlining it down a little bit.
But it's not, Candace, but it's not. Because
it is, because instead of having to go to a CNA agency, a private duty nursing agency, and then also the case management agency, you can go to the nurse assessor to understand health maintenance activities, CNA, intermittent nursing, and private duty nursing. Right now, we have individuals that sometimes have to get services from 3 or 4 different agencies and or get it from one and don't know that the others exist. This will help with the education piece. And yeah, we're working towards it, Pat. We really are. But I hear you, it is complicated, and we are really working towards it. Katie.
Hi, thanks. I had a specific question about the scoring as compared to the current authorization, which I know you talked about, I think maybe back in April, that if the need for skilled services that is identified by the nurse assessor is lower than the current authorized hours, but within 5%, the nurse assessor goes forward with the recommendation. If it's 6% or greater decrease, they are going to fill out the HMA portion of the calculator. So I had 2 questions about it. One was, it sounds like then the nurse assessor does need to have documentation about their previous authorization, but I thought you also said that no documentation is necessary besides the referral. So if you clarify that point. And then the second piece is, I didn't find this in the contract anywhere, and obviously it's not in rule. So how will this 5%, 6% requirement be enforced for the nurse assessors?
So let me get to your first question first. So they are actually going to have that data, and that is part of what we're working on, is making sure they have that data that is submitted over to them. So they don't have to have the documentation submitted by somebody else. It will come in from the department. So that's how they're going to know. As far as the enforcement, nobody's looking to, Telegen is not looking to change somebody's services and to get them something that they don't need. And so we will be monitoring this. There will be oversight. We're going to be looking at this monthly, these numbers. In particular, we are going to be looking at HMA specifically. So that is how it's going to be enforced, is with our ongoing oversight.
And then the follow-up to that is just what data you guys are going to collect and publish about it as it
Yeah.
launches. Thanks.
I've been talking actually to Julie Riskin, and we are working on exactly what we can publish around HMA, and it's specific to a lot of the increase, decrease. But again, we can't do it necessarily on a monthly basis because of Safe Harbor. So I'm working on that actually specifically with Julie Riskin around that data. Greg.
So just one more thing. So when we're doing intermittent visits, and let's say we have a diabetic patient, we're going in daily. Doctor wants us to go in twice a day and change that. When they change that to twice a day, is that what you're meaning, that we need to submit it to the assessor, or being that it's the same service, but it's more diabetic management, do we need to do one?
It's the same service, and so you wouldn't have to resubmit it to the nurse assessor. You would just have to justify the increase in the service to Accentra when you submit the revision. Does that make sense?
Thank you.
Yeah, of course. Great question. Okay. Cassie, I know, wants to follow up on a question that was in the chat, so I'm going to let her hop in really quick, and then I'll get to you, Molly.
Thanks. Excuse me. Thanks, Candace. I wanted to just clarify some information about the upcoming and what has been held from Telegen when it comes to training. There's 2 training types that we will be offering, or that Telegen will be offering. The first one is what Candace mentioned in terms of the authorized organizer, user, I forget what the Official, the authorized official. And so, for example, every case management agency right now is utilizing the Telegen Qualtrack system. And so they already have an authorized official. And what that person does is manages who has access and ability to use the Qualtrack system. So each home health agency is going to need to have that authorized official enrollment and then be able to enroll their different staff so they can make those referrals. So that's the first training that's going to be held, is that here's how to become an authorized official and then how you kind of function in that capacity. And then the second training that will be offered is going to be held in July, training that's going to teach you, here's what Qualtrack is, here's how you submit a referral, here's how you send a message, here's how you do X, Y, and Z. And so that authorized official training is happening now so that agencies can get enrolled and get kind of everything set up. And then everybody will be able to take that training offered by Telegen to understand how to operate within that Qualtrack system. So that information was published, as Greta put into the chat, about the within the bulletin. And so any agency that would be, so not just home health agency, but any agency that provides IHSS HMA. So anyone who might be submitting a referral, an IHSS agency, a home health agency, a case management agency, hospital, discharge planners, any of those entities would need to have an authorized official and have that training and then ability to get their staff set up in the Qualtrack system. So hopefully that is clarifying things for folks.
Thank you, Cassie. Molly.
Hi, Candace. Can you hear me okay?
I can, thanks.
Yeah. Okay, thank you. I wanted to revisit, I know you had said previously that a change in access to services, and in this example, it's like a denial or reduction in home health, CNA or nursing, would fall under that changing condition for accessing CFC services when it's not at the period, the CSR. Is that still the case?
Oh, great question. And yes, that should still be the case. Yeah, Cassie, can you check on that? And maybe we can get a finalized answer just to make sure. I don't think that changed with the CFC team, but let me make sure and confirm that.
Okay.
Great question, Molly.
Yeah, and my concern is, well, a few areas. So I know at the last CFC meeting, adding CFC, the CFC cert period has to align with the waiver cert period. And so when you have a mid waiver or, you know, off CSR changes, then a new waiver certification has to be issued, which means that needs to go to the county, right, to update the new waiver cert period, which then impacts when the new has to have a new PAR that aligns with the new waiver cert period. So it could get complicated with those, having to align those with a new waiver if it's an existing waiver recipient who's adding CFC mid-cert, which means the waiver has to be changed as well. And so it seems like it's adding on layers of weight because the county has to adjust that sort of thing. So
part of the reason why we sent out the CSR information to the home health agencies is so that they could align their assessment and their PAR submission to the member CSR. So it wouldn't be a mid-cert switch, so that they would be looking to submit the PAR, conducting the assessment at the same time that the member could be then also considering CFC. So that was the reason to help align that, to mitigate a lot of that. There's still going to be instances where it doesn't align perfectly, but for the most part, and all of the home health agencies have received those lists and are really, really diligent and working really hard and understand the rationale behind that and are super committed to staying on that timeline where they can.
Yeah, no, and I understand. I think that's great if we can all do that. But we now have a shortened period of home health PAR submission, so that's
not shortened. Remember, we just bumped the whole thing back, so it's not a shortened period of time. It's the same amount of time.
Okay, and then sometimes, you know, a nursing center will do a short authorization for nursing services, like we'll just give 6 months maybe to PDN, and then, you know, sometimes there are shorter approvals, and so that would be another example of when someone might need to access CFC off CSR.
I mean, and those are usually brand new cases. that they would do that. But yeah, I mean, we can work with everybody on the one-offs on those situations as they arise.
Okay, thanks.
Yeah, Brent.
I may have missed this if it was already covered, but I know it's been asked several times in chat. I'm wondering about how the nurse assessor will handle protective oversight for patients that have uncontrollable seizures when it's unlikely they're probably going to have a seizure during the visit. What kind of documentation or what are they going to need to see to know that that patient needs protect and it's are currently in their plan?
Yeah, so they're going to talk about the totality of the care and the interventions that are necessary. And, you know, if there are seizure logs available, they'll take a look at that. The member or their family is going to discuss how frequently they have seizures, what that intervention looks like. And so that's how they're going to be able to assess for that level of care. It's just like when you go into a physician's office, you don't typically have a seizure. I mean, depending upon the seizure disorder and things like that, but oftentimes they're assessing based off of the information available from the member, from the family, and from the nursing notes, which is exactly what the nurse assessor will do as well.
Okay, thank you.
Yeah, that's a great question. All right, Angela, and then I'm going to move forward because we have about 2 more slides to cover.
Yeah, thank you. This is probably aimed back at Cassandra. Just to clarify, if a case management agency already has an authorized user in the Qualtrack system, then we don't need to do anything. We don't need to attend any additional training on being an authorized user, or we do?
Good question. So if you all have your thing set up, you know how to operate that, you likely do not need to attend this training. You would likely need to maybe modify who all has access to Qualtrics now, because before it was maybe just who did HMA, and now it's maybe more with the shift to CFC. So you might just need to manage that, but you would not, if you all know how to be an authorized official, you do not need to attend that training, but you may need case managers to attend that additional training from Telligent to learn how to use Qualtrics. That might be helpful to them, but that authorized official one, you don't need to if you know how to do it.
And then on a second note on that is we had 2 authorized officials. One has left. How do we add a second authorized official back on? Is there a process for that?
That's a good question, and one I don't know off the top of my head, but we can get that answer to you, Angela.
Thank you. Appreciate it.
Great questions. And Deborah, I see your hand up. I want to make sure we have a chance to get through the other slides. So we're going to move forward for sake of time. All right, so post-implementation feedback. So this is something key that I wanted to make sure everybody's aware. We are not done once everything is implemented and started. It is not when, okay, Nurse Assessor's live, we're done, see you later. We are working on an entire process for the feedback. So we have some short-term options, which is distributing a stakeholder support plan for all of the projects. So we have a number of projects, CFC being one of them, which is probably the biggest. That would be starting July 1st. Obviously, this one is now starting August 1st, but is going to include a process for member and advocate escalations. We'll have case management agency office hours. So there's some short-term options that we're going to deploy immediately starting July 1st. And then we have some long-term ones as well, which would include a feedback form, which we're developing, that you could provide some information around the nurse assessor process. And then Telligent also will be conducting an annual satisfaction certification or survey. I really want to say the word certification for some reason, so forgive me. So they will conduct an annual satisfaction survey. Got it right that time. With members and providers about their experience. And so that'll give us some long-term information around how things are going. And so this is something we're going to continue to check in on. We're going to continue to have, monitor the process, receive feedback, hone things as necessary going forward. Next slide, please. Oh, keep going. Sorry, one more. So there is actually one small shift on this one that we didn't get updated yesterday, but this is just a timeline. And instead of the nurse assessor being live in July, that's actually down to this now. So you can just moved the July items down to August. But essentially everything is going to be live. Everybody will be submitting referrals, and we will have office hours and continued education. Next slide, because it has contact information on there. There we go. And there is an email that if you have specific questions that you can send them to the email. And then obviously our website. Our website is constantly being updated with our listening log, our posting of meetings, our recordings of meetings, information in general. So please, 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 if you are interested in this project, bookmark that so that you can get and you can see the latest and greatest information that is happening with this project. With that, I want to say thank you. I do know, Jimmy, I see your hand as well, but I moved on from Deborah as well. So if you guys could put your questions in the chat so that we can capture all of them, get them put into our listening log and get that all posted, that would be really helpful. I would like to take a minute to say thank you to everybody for joining. Thank you for continuing to work with us on this process. I appreciate all of the engagement, all of the time that you guys are spending with us to ask these wonderful questions to make sure that we have all the information out there. Trainings will begin. Again, the authorized operator, I don't know why I can't really get that term. The AO is what we're calling it. Official, thank you. Authorized official. I don't know why that word is hard for me. Those trainings, the first one was this morning. Those will be happening. And then actual working through the system, knowing how it works, how the workflow is in Qualitrack itself. Those are happening in July. And we will get all that information out. Please make sure you are signing up for those trainings. They're really helpful. They're really important to make sure that you understand how the system works. Your agency is ready to go. Members are ready to go, and everybody can have a successful launch on August 1st. With that, I want to say thank you again to everybody, and I hope you have a wonderful, wonderful rest of your June, because it's already summer, which is crazy. Thank you for joining us again today. Have a good day.
Thank you.